I'm starting a YouTube channel. Don't even know how to start it, but I'm trying to get it started because I want to catalog my son's journey through neuroblastoma. It is a high-risk neuroblastoma, and not only that, my son Mohammed, who is 5 years old, is also diagnosed with autism. He just turned 5, and right before his birthday in March, his diagnosis of a tumor coincidentally was found in December, end of December. By January it was confirmed, and by February the tumor was removed via surgery and laparoscopically, which means they do like 5 small incisions and they remove it. The assumption was that because it came as localized, they assumed that it was a low-risk neuroblastoma. Pathology came back, and about a month after the tumor was removed, that it was indeed high risk. And so basically I would like to take you through the journey. It's a very difficult process. I'm realizing that going through it, and not only cancer itself is difficult to go through with your child, especially so young, it is even more difficult when your child has autism. Muhammad is nonverbal, and he had an onset of autism at the age of about 2.5. Now he is 5, so he's had autism for about 2.5 years. What is unique is that the combination of the two, having autism and also neuroblastoma. Neuroblastoma is a rare childhood cancer. It actually does occur quite frequently, but it is still considered a rare cancer, and prognosis for that with treatment is about 40 to 65%, something of that nature. Muhammad is being treated, so basically I will have multiple videos talking about that, about our journey, what it takes, the toll that it's having on our family. Alhamdulillah, I think that we are trying our best, and our the siblings have cooperated. Muhammad is one of 4 kids, so he is the youngest one, my oldest being 11. They're pretty strong. They don't necessarily understand. I'll talk about what their journeys are along with it, because not only a person who is going through treatment goes through this journey, it's the parents, it's the grandparents, it's the siblings, anyone who is close to you, your friends, your family. Everyone goes through this journey. It hits the hardest on the parents and the children, obviously the siblings, because they live through it. They see their sibling missing days, not being home, the parents not being home, at hospital visits. I was thinking of starting this channel a while ago, but we've been so busy, honestly, just trying to get him started on chemo and go through it and understand that it was not necessarily possible. I won't necessarily have a very regular duration of when I'm going to do this, frequency, sorry, but I'll try to do as many as I can in terms of whatever seems to be new that's going on. And if you have questions, you can ask, but I don't necessarily have answers. I am just truly just cataloging what we are going through and what our journey is, and how it can be difficult for other families. We are very blessed that we're able to do this relatively with ease, I would say, to what the situation can allow us to say. But alhamdulillah, I would say that we are one of the fortunate ones who can get the medical treatment that we need immediately, and not everyone does go through that. And how even getting a diagnosis can be difficult at times, especially with children who have special needs. So especially with Muhammad not being able to speak or explain how he feels, because he doesn't have sign language, he doesn't have any language whatsoever, any means of communication, not even sign or different ways. So he would just cry, and we just coincidentally found out about a tumor on his adrenal gland, and then from there it was looked more and more, and then oncology was involved, and that's how we found out, and we are where we are. Went very fast, but not everyone is that fortunate. The disease spreads. Neuroblastoma is a cancer of the nervous system, which means that wherever your nerves are, neuroblastoma will affect it, whether it be your bones, your bone marrow, your soft tissue. So predominantly Muhammad's primary area was the adrenal gland, which is generally where this presents itself, neuroblastoma does, and that was removed. But right now, in 3 months, so this is July 5th, one day after 4th of July, we are at cycle 3 of chemo. I will talk about in another video what is the protocol that we are going through and where we are as of now. Getting a diagnosis during COVID in a way is a blessing again, because everyone is wearing masks, and in a way, if you can't see someone behind us, but basically most people wear masks, especially in the hospital, so that prevents the disease or any viruses or bacteria from spreading. In our case, because Muhammad has a lot of sensory issues, a lot of sensitivities, a lot of different textures and other sorts of issues, where wearing a mask would be very difficult for him. In that case, for a child with special needs, having a COVID alert going on, or it allows people to wear masks, and it protects them, and it also keeps hospital relatively safer compared to when there would be more people. And now, as you can see, there are very few people. The crowd is very little, very, very minimal staff, very minimal people. Only the people who are sick are here, or would have one visitor if it's a child. So that alleviates some of our concern about different spreads. Neuroblastoma, or having any cancer treatment, leaves you immunocompromised, which means that your immune system is not where most average person's immune system is. There is this thing called neutrophil count. Muhammad's neutrophil count drops to 0 for a couple of days or even a week. We'll talk about that in another video, but just wanted to introduce myself and introduce the purpose behind the videos that I will be sharing. Again, it is strictly educational for others to understand what neuroblastoma means, because when I talk to people right now, no problem. When I talk to other people, they don't necessarily know. It's not a common cancer. So I will talk more about that, and especially for a child with special needs to go through that journey. Thank you.